Today's video is about activism, absolutism, and exclusive versus inclusive thinking. We're going to start with a basic bit of information. I will be leaving links below on best practices for in a hospital, outside of a hospital, etc. to reduce the transmission of disease. Warning, anybody contradicting reality, that means Robert F. Kennedy and anyone who agrees with him, is not allowed to comment on the video because you're a bunch of idiots. 2, yelling mansplaining in this case because I'm talking about someone who happens to not be male. Possibly making a mistake or going out of their way to being an activist on something, that's a dirty word with me. Yelling mansplaining will also get you no posting, unless you do it as a joke. Here we go. If health experts know or have found that more than 80% of pathogens in general, pathogens that are able to be tested for, that's what this is based on. It's what you can find, not what you can believe. That these pathogens can be passed by hands, 80% of them, of health experts and health associates at a hospital, transferring as a vector, that's a word we usually use for vermin, being the vector between patients. This patient's infected with something, it's not really harming them, but this patient is oversensitive to it and it transfers. If the hands of a medical professional in a hospital environment, 80% of the pathogen can transfer that way, what do you think your odds of not having it transfer because reasons? Yeah, it's 0. So let's move on. You are a vector. We are all filthy. A doctor's hands are always clean was an aphorism that you would hear people say until people were basically compelled by pain of being fired and humiliated that doctors had to wash their hands between visiting a person who is just got a mild infection and is getting over it to a person who's immunocompromised to a person who has abscesses leaking and not washing their hands between. Sometimes proudly wearing a shirt showing how much work they got done that day with their smock covered with blood and pus. The reason we have these rules and the reason we're not allowed to forget the evil past and repeat it is because you're required to wash your fucking hands if you do anything in a healthcare environment. Why am I angry sounding? Because people who take care of your cat and dog are required to do that or they're monsters. Don't you think they should treat your child with the same level of care they do with a kitten? Or a baby squirrel? More than 80% of all illnesses can be transmitted by our hands. So wash your hands with soap and water. Now, here's your quiz question. Who in fuck would find a way to argue against this being constantly repeated to healthcare professionals till they become irrationally angry? You know, the variety of person you want to listen to this that rejects it or gets angry about hearing it every day. Isn't that the kind of person you kick out of the medical system? Let's move on. If this is available, it's simple. It can be done in ways that doesn't cause any harm to the person doing it. Even if you have a sensitivity, just use a kind of soap that keeps you from having sensitivity. Yes, someone will scream they worked in an environment where they were required to use soap that they're filing a court case over, and they have to keep saying that it caused some horrible thing. Those aren't people that are being reasonable at this point. Yes, you might have had a sensitivity. Just get a goddamn deferment and get the other soap that worked. Shut up. Yes, I'm talking about a person at a vet clinic that killed a bunch of pets. If available. If it's not available, here are the order of operations. 1, stop touching the patients. 2, use alcohol-based hand sanitizers and then use completely sterile packets of hand lotion to keep your hands from being damaged, which also contain antimicrobial characteristics. Get preventative shots so that you aren't a carrier, because you are a vector. You are vermin when you walk into the hospital. The explanation I got when I was cleaning is every one of you is a filthy animal, and you're going to act like you're completely covered with fecal material and make it impossible for transfer. Make failure impossible wherever possible. Your failure will kill someone. Don't fail. Hearing that over and over again every fucking day, and hearing people defy it and push back, and watching them walked out of the building and barred from ever working in a health environment for life. There's a certain mindset the medical system has figured out, we'll call them RFKs, that cannot, under any conditions, understand that they are simply wrong, and no one has to listen to their argument. Participation trophy people need not attend. Take every preventative action. Each one compounds on each other. Security technician rule 1. They're all rule 1. What is the next rule 1? Every form of security stacked on each other. Yeah, but rule number 1. Your yeah, but is irrelevant. You must shut up. Yeah, but you're barred from having access to the network. Yeah, but you're walked out of the door because you're a security problem because you won't listen to stop doing stupid shit on a computer network. 90% of making shit not break is keeping stupid people from breaking it. That includes your grandma, your kid, or your kitten. Please note, hospitals use HVAC systems that include air filters. Dedicated air filters to trap contaminants from or to operating theaters and ward areas. Because the same place is supposed to be sterilized so you can do brain surgery, which is actually a bit different and maybe more or less than the one that's for hip surgery, has to be fucking sterilized to the point that literally no life forms present would be your little sci-fi scanner result. No, I mean, not kidding. They literally wipe clean every life form in it because every life form is a threat. Airborne pathogens are defined as those that can be transmitted in any way, shape, or form through the air. That means something can be declared to be airborne, but it doesn't mean it's exclusively airborne. The exclusive versus inclusive brain fart people have. Let's move on. Small particles that can be suspended in the air. These are called aerosols. Any liquid spray droplet from any source, a breath, a flushing toilet, you sneezing, speaking, coughing, any human behavior, farting, or just from walking around, because it can also be just dust or dried material that has gone into a cocoon state, which means it's just as deadly, but it can last even longer. If you are ill, you can help protect others by washing your hands regularly, because we use our hands for fucking everything, and wash your face, but at least wash your hands, because people don't normally touch your face. If people do, wash your face every chance you get. I don't care if you like it. Stop wearing the makeup if it's getting difficult to reapply it. Also, makeup carries a lot of pathogens. Look it up. If you're coughing, sneezing, do these things. Take care of yourself. Stay at home if you can. Consider wearing a mask if you do have to go into public places. And if there aren't any masks available, do your best. Don't just say, oh, I can't do everything perfectly, so I'll throw it all out and become a pathogen carrier. Go ahead and become a plague. The most effective way helping protect yourself from winter bugs is to wash your hands thoroughly with soap and water. Keeping hands clean and encouraging children to practice good hygiene as well. Because children don't know these things, don't take any precautionary measures, and the bare minimum of having them wash their hands and face, if possible, reduces transfer a massive amount, on the order of 80% or more. We can significantly reduce the transmission of infections if we do everything possible. Now we're going to a retired nurse who mainly worked from 1988 to the year 2022, at which point this person quit, or something, at Glasgow Royal Hospital, named, I'll bring up the name in the end, who says there's no evidence, none, to support any of this. It's inexplicable that any experts should consider, let alone advise, such nonsense. The search for evidence is over. It's not there. If we get transmission wrong, we get precautions wrong. And prevention fails. Please explain, how does hand washing reduce the incidence of airborne virus, which enters via inhalation? Okay, you numbskull. Because it's not exclusively airborne, it's inclusively airborne, which means it's fucking worse. An airborne infection can be filtered by you wearing just a mask and staying away from people and all of that shit. But contact transmission, this is specifically about something that can survive on the surface of a brass metal sheet for 2 years. That means brass does nothing. That means the doorknobs do nothing being made from brass. It's not falling apart because of electrochemical responses. This is something that's very durable. Yes, but you said it's airborne. Because someone somewhere said airborne transmission exists, therefore all other transmissions can't exist. There is no fucking way this bombastic idiot is mistaking this. This is contrarianism after this individual left Royal Hospital in Glasgow in 2022 so that they can be on Twitter and try to get some of that contrarian money and attention-seeking behavior. Then the advice comes in. Open a window, okay? Buy HEPA or HEPA filter. Wear a mask. Yes, but when the masks ran out and when the filter's clogged, you're still going to have to wash your hands and your face and the entire environment. And by the way, bitch, you work in a fucking hospital. Worked. Dr. It's the nurse with a doctorate. Evonne T Curran. I'm not questioning the person's qualifications. I'm not questioning any of this. This is exclusive versus inclusive mindset. If I wear a seatbelt, it reduces my likelihood of dying in a car wreck. If I have an airbag, it reduces it. Well, why should I wear the seatbelt if I have the airbag? Because they add to each other, you fucknut. They don't. It's not a zero-sum game where if you use the seatbelt, it nullifies the airbag and vice versa. None of this shit makes any sense to anybody who thinks even one more step deeper. This is a troll on Twitter. Tell them off. But they want to tell them off. Contradict them. Add context. Twitter or X is a misinformation factory. Now I'm going to bring up the Trump 1 people. Hi, how you doing? A shit ton of you, it's on the order of 50 or more % of people who were that mindset are figuring out that they've shot themselves in the dick. That's why it's called the dick move. That's actually the origin story I heard anyway. You can correct me on that. We can have that argument because it doesn't make a damn bit of difference. But one argument we don't get to have is whether or not contrarianism is fucking dangerous and stupid. Literally picking something that's an unquestioned fact and questioning it is not a problem. Doing this sort of argument where you're technically saying something that could be an argument that would be tolerated, except you're excluding the fact that we should do everything possible to prevent disease transmission. Now I'm going to bring up the actual reveal. For those of you who haven't figured it out, increasing the death rate in a society is of financial benefit to people who are powerful and rich. Some of you already knew that. This is eugenics by another name. This is death panel by another name. These people want to increase the death rate so there's more to go around. They're rats on a ship. It's sinking. And they're thinking, instead of running off the ship, or just make it not sink, how about we just drown everybody under us so we can get to the top of the drowning pile? Yes, that's the movement you're dealing with. If you're in the United States, Britain, anywhere. This happens every fucking time people get desperate. And manufactured desperation, the United States is experiencing that. None of this shit is by accident. No, it literally isn't. These are individuals who had full power over what would happen, and they caused a bunch of shit. Did that happen during an incident we're not allowed to use the name of? That's named similar to a drink you could buy. No, it didn't. But you can believe what you want to believe. But people like me will contradict you when you do this for the obvious reason you want to increase the death rate. Fuck you, death worshippers. Thanks for watching. Have a good day. Good luck with that. Goodbye.